Hello everyone, I'm Dr. Y. Coney and welcome to Bright Star Baby and Child Clinic. In this video, I would like to talk about asthma and its myths and facts. There are so many stories about asthma. You can hear it from someone's neighbor, hear it from a friend of a friend, and also tales from the older generation. Here, I would like to bust some common myths about asthma and also talk about interesting facts that you may or may not know about asthma. Let's start off with some interesting facts on asthma. Number 1. Did you know that asthma is the most common chronic illness of childhood? Number 2. Did you know that as of 2012, there are more than 18 million adults and 6 million children that suffered from asthma globally? Number 3. Did you know that in children, boys are more likely to develop asthma than girls, but in adults, women are more likely to develop asthma than men? Although we now know more about asthma than in the past, many people still have outdated beliefs or misconceptions about it. Below are some very common false beliefs on asthma. The first myth is asthma is all in the mind. It is a psychological disease and not a real one. The fact is, asthma is a disease of the lungs and airways due to chronic or long-term inflammation. It does not stem from the brain, nor is it psychological. Some people do get worsening of symptoms of asthma when they are stressed, but this happens more so in adults than in children. Asthma patients, through a variety of triggers, their lungs get inflamed, and that starts the changes in the airways. It is a very real medical condition that requires supervision and controlled management. Myth number 2. People with asthma should use medications only when they're having an attack. Otherwise, the medications lose their effect. The fact is, regularly using medications is the only way to calm down the underlying airway inflammation and prevent asthma flare-ups. Used at the correct dosage, daily medications do not lose their effect or cause uncomfortable side effects. Effective anti-asthma medications include inhaled beta agonists such as salbutamol that can stop attacks, and inhaled steroids, long-acting beta agonists, and leukotriene modifiers to prevent attacks from occurring at all. Sometimes, these medications need to be taken longer term, even when the patient is having no symptoms. Hence, this class of medications are called preventative medicines. Third myth, someone with asthma can outgrow it. The fact is, most people with asthma are born with the tendency to have asthma and they tend to keep it for life. It is true that many children do get much better when they grow older, and it seems like their asthma completely go away with age. However, many of these children have their asthma conditions return in adulthood. Other children may have persistent asthma that never goes away and lasts even when they are adults. Myth: asthma clears up when you move to a warm, dry climate. The fact is, if medications are taken properly and environmental measures are taken as directed by the doctor, people with asthma can live comfortably in any place that they want to. Very rarely do people with asthma have to move away from their city because of their condition. Myth: asthma can be cured. The fact is, asthma cannot be cured. It is an inflammatory condition that is always in the airways, whether or not the person has the symptoms. Exposure to an asthma trigger can worsen symptoms, but the underlying condition never really goes away, although it can sometimes be controlled with the proper medications if used correctly. Myth: asthma medication is addictive and one can be dependent on it. The fact is, that is simply not true. Asthma is a chronic long-term condition, so patients with asthma may sometimes need to take their medication longer, but it is not because they are addicted to it or dependent on it. Also, the long-term medication stabilizes the inflammation in the airways so that the attacks are reduced, and hence there are less need for medications for future attacks. There are no components in the asthma medications that are deemed addictive. Myth: the steroids used to treat asthma are the same steroids as the ones that are taken by athletes to get bigger and stronger. My child will turn muscly. The fact is, it's not true. The ones used to treat asthma are called inhaled corticosteroids, and they are not anabolic steroids that are used to build muscles. Myth: nebulizers are the best way to give asthma medications. The fact is, it's not true. Medicines given by inhalers using a spacer and a mask is just as effective, and when used together with oral medications is the best combination sometimes. Myth: one can stop taking their asthma medications once he or she starts feeling better and the attack has stopped. The fact is, you should only stop taking your rescue asthma medications when you have been instructed to do so by your doctor. For the most part, preventative medications need to be taken longer, even when you are feeling well. That's why they are called preventative medication or controller medication. This is to prevent future attacks. When you feel well and don't have any symptoms, that is because the medications that you take long term are working. However, one thing to note is that you should not take your rescue medications such as your salbutamol. One of the examples is your inhaled Ventolin, the blue puffer we always say, when you feel well. It should only be used when needed. For example, when you're having difficulty breathing, coughing severely, finding yourself hard to catch your breath, or as a pre-treatment before exercise. This should be as directed by your doctor. Myth: if my child has asthma, he or she should not be allowed to participate in sports or have any strenuous activity or play too hard. The fact is, that's not true. All kids need to play and be active and exercise to be healthy. Kids with asthma can play, take up sports activities, go to the gym, but they may need to take medication before they play. Kids with asthma that are not under control may not be able to keep up with their friends or peers, or they may get tired out or may develop symptoms when they play. It is because their symptoms are not well controlled. That's why they have difficulty keeping up with their peers. So they should take their asthma medications regularly to prevent their lungs from being inflamed, which gives them a better chance at performing well in sports. Myth: having asthma is no big deal. No one dies from it. The fact is, about 10 people each day die from asthma. It is a chronic and incurable disease. Millions more patients and their family members are affected by it. All types of asthma is serious, and any flare can turn into a life-threatening event within seconds. Asthma is also different for each person. The severity of asthma is sometimes determined by many factors, including age, family background, race, gender, their living spaces, workplace, environmental factors, immune system development, and also general health. Getting a correct diagnosis and developing a treatment plan for each individual are important aspects of management of asthma. With the appropriate doctor, medications, education, and use of management tools, asthma can be well controlled. Now we come to the end of the video. I hope you got some learning points from it and that you no longer believe in some of the myths. Stay tuned for my next video. Till then, stay safe and take care.